So 37% of every married women have experienced marital violence. 33% said that this has occurred in the past year. So one of the things with violence research is that there can sometimes be reporting biases. So for example, somebody may have been slapped in their first year of marriage and it didn't happen again, it's 20 years later, she's probably less likely to report it. So we don't know how accurate it is, but to a great extent, those who feel that, those who are abused currently, or those who have ever experienced violence, this is something going on in their lives. Who is at greatest risk? And I'm sure you see these issues coming up even here and when the presentations are domestic. You have what I call contextual. This is my framework. And I'll show it to you at the end. But my framework is that you have a context, and then you'd have the gendered aspects of that context. And I really disentangle the gendered pieces because there is racism, there is sexism, there is classism, there is heterosexism. We oftentimes will talk about, especially in the US right now, the racial disparities, the socioeconomic disparities, and what gets lost in that is gendered disparities. And so I'm really working very hard to disentangle those gendered elements so that we can really understand them, focus on them, address them, and get rid of them. So contextually, yes, the women at greatest risk are rural, living in poverty, haven't had educational access. There is variation across states, but when you look at the states most heavily affected, you see just greater socioeconomic vulnerability for the state as a whole. They are less likely to have access to local health care. This is the most vulnerable. This is actually consistent pretty much across every country. Gendered vulnerabilities. You're more likely to see a larger age gap between the spouses, with the husbands being substantially older. By the way, it has not come to pass, but there still seems to be some, most of the research I say it has not been shown to be the case. However, people have discussed in the context of the US of the gendered vulnerabilities for violence for like a 15-year-old girl dating for the 24-year-old boy. Okay. Gaps in education and income, she's going to be more reliant on him. And the in-law presence, either in residence or nearby. Have you ever heard of the issue? So one of the people's like, oh, that sounds horrible. Has anybody ever heard the term patrilocality? So what is patrilocality?
You live in the husband's house, the father's house.
Yeah, and it also means that you will live closer to where he lives. Now, I don't want you to answer this question, but just think to yourself, if you are married, if you had a mother, which most of us have physiologically, it would be striking if you didn't at some point. So think in terms of when somebody moved, who moved for whom? Typically, women move for the husband. Typically, in marriage, women will move toward where the husband is. He is more likely to near his family, and that is more likely to be the place of residence. That is true in every society that I've ever studied. So this is an issue of the joint family without question, but I can tell you that joint family does not predict partner violence solely. It's presence, meaning they have a greater influence in the life. You don't have to be living with them. And then restricted mobility. One of the key elements is the issue of being able to get out and do whatever you want to do. All right. Exactly the same issues apply for those who marry at a younger age. And actually, well, we'll see, but violence is more likely for younger brides. And that's the next piece I'm going to tell you. So the data I'm going to present today is going to come from two different, there are papers, a series of papers we've done based on two different sets of studies. One is national data, nationally representative data that was available to us from government data collection efforts, and the other was an NIH grant that we received. Dr. Jay Silverman was the PI, and I was co-PI on the study, and it was really to look at a population, as what we call a perinatal sample. So it was a population of women postpartum and ask them about their experiences. And so I'm going to present the data from these, and I'm going to highlight which came from which. Oh, my paper. That paper. Oh, thank you, thank you. Okay. If I'm going long, I won't do this, but we have some qualitative data, and I thought I would read quotes if we have time. Okay. All right. So just really quickly, you can just take a look at this. It's not very consistent, but this just shows, I'm going to be focusing on a 20 to 24-year-old sample. And the reason we look at that for child marriage is specifically because, and I think I showed this to you, but it's 45% of women 20 to 24 years old are married as minors. I look at that age group because you have to have enough time for it to show up as married or not married, 20 to 24, but you don't want to, like, obviously people married at a younger age a long time ago, that may not reflect what's happening in today's society. So 20 to 24 years allows us to understand what's sort of going on, what are the norms and behaviors of today. And you can take a look at this. There's nothing particularly striking. It's consistent with what I presented as far as prevalence of violence. And you can see that sexual violence is less likely to be reported. And largely we feel that that's because, and this is true in sets of data we've gotten in the US with diverse populations, it's harder to define, for many women it's harder to define sexual violence in the context of their marriage. Okay, all this is, I'm going through this fast now, all this is that what we see is those girls, those among 20 to 24-year-olds, those married as minors, are more likely to experience abuse. And this is what I think was the key finding from this study. They are more likely to experience abuse recently as well, which means it's the gift that keeps on giving. Just as we saw that if there's violence early, there continues violence, if the vulnerability starts early, the vulnerability is maintained. Okay. So now I want to talk a little bit about the study on in-law abuse. So this is the idea that the abuse would actually, so the term domestic violence is often used, and in the US I think it's largely, it's about partner violence, but then it's also about child abuse and abuse of elders. This is actually a slightly different phenomenon. It's abuse from in-laws. I did a study in the US where I looked at this issue with South Asians in the US. And I went, as part of my data, I went and I was like, God, is there anything else on this in the US? And surprisingly, I found abuse from in-laws in other populations, sort of discussions among victims of domestic violence, so how much did they talk about it? And what we found was actually, it was at a similar level to what was found in other populations. And it's very interesting because basically, it makes sense. I mean, if we know that there's a cycle of domestic violence, the idea that this could be reinforced by the parents of the partner, it does make sense. It's not something we're looking at in the US. And one of the things I think that's great about doing research in other countries is it helps us think about things that we're sort of not necessarily thinking about here. So this is just a general overview. You can see that our population is slightly different. This is a single slum, no, it's 3 slum communities in Mumbai. It is a more highly Muslim representation. You can see that, you know, a smaller proportion married as minors, but like I said, it's an urban group, still a pretty notable proportion. And you can see that you've got higher rates of formal education, et cetera. It's basically, it's an urban community, so it comes with certain benefits that India as a whole is not going to show you. Let's see if there's anything. Okay, so I'm just going to point out these ones. Surprisingly, for this population, I was surprised to see 62% live in a joint family. The 36% experienced marital violence is consistent. And the perinatal violence, it means that did it happen either in the pregnancy, immediately before pregnancy, or postpartum period. So that's consistent with the national data. Living in a joint family is higher, and we think that's because of the very expensive cost of living in Mumbai. Okay. All right, so this is the idea of perinatal abuse. What we really wanted to know was, what does this abuse look like, and how does it relate to the violence from the husband? And we really wanted the perinatal period because we wanted to understand it from how it's going to affect maternal and child health concerns. So we wanted to get it as proximal to that period. And 36% reported that this occurred at any point. You can see during pregnancy it was more likely than in postpartum. I was actually surprised by that. I thought that in pregnancy they would have been more protective. But you have to realize that we had a very broad definition of what we defined as abuse. I'm not using the term violence, I'm using the term abuse. So insulting her, forcing her to bring money from natal home, impeding access to health care. You start to see it's just getting dwindling and dwindling. Impeding acquisition of food, impeding rest, interfering with her going to her natal home. That is a very common phenomenon where you would go to deliver at your parents' house, so this is a culturally appropriate approach. She was impeded from doing that. Actual physical abuse was reported at a very low level. And what you found is that, in fact, when it happened from the in-laws, it was more likely to be the case that it happened from the husbands as well. Or should I say, when violence was coming from husbands, you were more likely to see the abuse from the in-laws. What I thought I would do, I think it's interesting. Numbers are lovely, but voices are so much stronger. And this particular study, I had mentioned it before, it had a mixed methods approach. So what we did was we did a survey with a larger group of women who were presenting for care, for vaccination care, 6 months postpartum, because their child was now ready for their 6-month vaccinations. Everybody during those recruiting hours was approached. We had I think it was like a 92% participation rate. In addition to that, we had, just prior to doing the survey, we wanted to identify items to include in the survey. We did a qualitative study. We got women, same line, we asked them to come in and we screened them for abuse from husbands. It could be no, it had to be physical or sexual. So very, very biased sample at this point. And this paper presents, of that subsample of women reporting abuse from husbands who are 6 months postpartum, how did they describe the experiences of abuse they had from in-laws? So verbal abuse and harassment during pregnancy. I'm just going to read a quote for each type of issue we found. In pregnancy, my mother-in-law always taunted me. I felt very bad at that time. Actually, she just hates me. She kept harassing me on small things, like I do not wash clothes properly, I do not know how to cook food. For so many things, she always criticizes me, and my sister-in-law always takes her side. So this may be like, so what? She doesn't like the way you cook, right? But for anybody who's been married, even in optimal circumstances, your mother-in-law saying you don't do the domestic job well, it is a label of who you are. So they're getting that. One of the things we really heard about was that's where the criticism lay. The traditionally female role, you're inadequate, you're not good enough. They're going to dig where they're going to hurt you the most. Also, part of that was related to the fact that there was, especially in the context of joint families, there's an expectation of the young females to be engaging in a great deal of domestic labor. And forced domestic labor in pregnancy was also identified. I used to get up at 3 or 4 o'clock in the morning to get the water. Now, to get the water, you carry jugs. You have jugs, and you go to the water, the well, or whatever the water cistern, whatever it is. You go, you put the water in, and you carry it back. This is heavy lifting. What is this likely to do? If you carry something very heavy in your pregnancy, you are likely to miscarry. And so the reason we did this study actually was very specifically because we have long seen data, and actually from many of the people in this room, that partner violence increases the likelihood of maternal and child health concerns, right? And we were like, why? So there's been a lot of discussion. Is it stress? We wanted to sort of tease apart. So sometimes it's not like literally the violence, it's some of the things associated. This compromises the health of the mother. So we have a separate paper on actually the analysis on that. I'm not presenting that today. Impeding access to medical care in pregnancy. Only once did I get any health care. When my hand was severely burned by my father-in-law, I went to the doctor. As I told you, my in-laws and husband never gave me money for medicine. During my 8th month of pregnancy, my mother-in-law, sister-in-law, and father-in-law chased me away from my house. It's financial burden on the family when the pregnancy occurs. So sometimes people want the pregnancy, and sometimes they don't. And how you were treated depends on that. By the way, the burning happened because she had made mutton, lamb, I think I'll mention this later, and she had forgotten to put the salt in. So the father-in-law threw it at her and burned her hand. And the likelihood, again, of infection by non-treatment in a burning situation compromises her and her child's health. So eviction in pregnancy, I just gave you an example. There are many other quotes around this. We think this is a particular issue in the context of urban slum communities. We have not done this work in rural areas, but there is an intense financial burden to try to survive in these slums of Mumbai. It's extremely expensive. You could make it the equivalent of trying to survive in New York, for example.